Katavi, Western Tanzania. A national vaccination program is taking place to deliver immunizations against measles, rotavirus, and other infectious diseases that pose a threat of a widespread outbreak.
Ugonjwa wa surua ambao ulitukumba katika wilaya yetu ya Mpanda, na tumeweza kuwachanja watoto kwa sababu tunajua watoto ndio taifa letu la kesho.
The success of immunization programs like those seen in Katavi and many distant areas of Tanzania has not been without its share of difficulties. In the peak of the COVID-19 health emergency, as the world was focused on vaccinating against the virus, Tanzania found itself struggling with one of the lowest vaccination rates in the world. And not just for COVID-19, but for other routine immunization programs.
Due to some of the problems, which including local beliefs, and some we are trying to tell people some other ways which are not good, trying to discourage people to do vaccination.
There were reasons for the initial low vaccination rate in Tanzania, as was the case in a number of African countries.
The reason for vaccine being low acceptance, there was no enough time to prepare the community, because that was the pandemic, you remember. So during the hurry, we had not prepared the community adequately.
Vaccination hesitancy and misinformation cast a shadow of doubt over the efficacy and safety of vaccines. To add to the challenge, accessing vaccines was also a daunting task.
On the one hand, tests created at lightning speed and vaccines developed in record times. And on the other, a lack of preparation. The vulnerable hit the hardest, and vaccines hoarded by many countries as people in poorer nations went without. The impacts remain unequal to this day.
The pandemic had disrupted global supply chains, making it nearly impossible for African countries to secure the life-saving doses. In the event of availability, the next challenge was addressing the delivery and administration of vaccines to communities. The lack of adequate cold chain delivery capacity and storage facilities for vaccines posed a significant challenge to the effectiveness of immunization programs in Africa. The COVID-19 pandemic accentuated the cold chain storage challenges, with the sudden surge in demand for vaccines and the specific storage conditions required. The importance of maintaining the cold chain became evident as vaccines were approved. However, in the face of adversity, Africa's resilience shone through. Recognizing the urgency of the situation, the continent rallied together and engaged key partners to help build a solution. Under the Saving Lives and Livelihoods partnership between the Africa CDC and MasterCard Foundation, there was a focus in addressing critical gaps in vaccination and supply and delivery systems. Investments were made to provide proper storage equipment, with approximately 44,000 cold chain equipment procured and deployed across 32 member states, ensuring that vaccines remained potent and ready for administration. One of the key areas of focus for the Saving Lives and Livelihoods initiative was improving cold chain storage. Maintaining vaccines at the right temperature was crucial for their effectiveness, especially in remote regions like Katavi, where infrastructure was lacking.
Inakwenda vizuri. Tunajua sasa hivi watu wameanza kuhamasika.
Ndio. Bana kituo chetu ndio hiki hapa. Cha kutolea huduma ya nini? Ya chanjo.
By August 2023, the Saving Lives and Livelihoods initiative had administered 35 million doses, contributing to the continent's current vaccination rate of 53% of the target population, up from just 3% at the start of the initiative. The initiative continues to contribute towards the building of resilient healthcare systems through collaboration, equity, and inclusivity.
But when they integrate the COVID-19 vaccination campaign and the routine immunizations, we are able now to go beyond the area where there is no health facilities.
Combined with national and local leadership, Ministry of Health and other partners, Tanzania's COVID-19 vaccination coverage has now increased from a mere 1% to an impressive 70% at the start of 2023.
Lakini niwahakikishie Watanzania jitihada tutafanya, wale wote ambao kwa hiari yao wako tayari kuchanja, tutahakikisha chanjo zinapatikana.
By applying a test and learn approach, the initiative aimed to strengthen national health systems across Africa, and the impact was profound. Routine vaccines against polio, measles and tetanus, once hindered by logistical obstacles, were now also being delivered to the most far-flung regions, finding their way to the very heart of Africa, safeguarding lives. Places like Katavi, where vaccination rates were initially low, are witnessing a change of tide. Tanzania's progress serves as an inspiring example for the rest of Africa and the world as Africa's journey towards strengthening health systems takes flight.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
While the COVID-19 pandemic posed a significant challenge to the world and to Africa, it also presented an opportunity to rethink, shift, and reset. Prior to the COVID-19 pandemic, the prevalence of acute diarrhea in Hara, Ethiopia, was alarmingly high, putting the lives of millions of children at risk. In the face of COVID-19, Ethiopia took the initiative to implement improved practices focusing on water, sanitation, and hygiene. These measures not only helped control the spread of the virus, but had an unexpected positive ripple effect on overall hygiene standards in communities across the country. By harnessing a multi-dimensional strategy that incorporated public health interventions, bolstered healthcare capacity, and forged innovative partnerships, the incidence of acute diarrhea in Ethiopia witnessed an astounding 14% decline by January 2022. And one of these visionary partnerships was quietly working to change the healthcare landscape of the continent.
We formed a partnership with the Africa CDC. And it is based on 4 pillars. First, to purchase vaccines for 65 million people. Second, to roll out vaccinations across the continent to millions and millions more. Third, to lay the groundwork to build that workforce for vaccine manufacturing on the continent. And fourth, importantly, to invest and strengthen the Africa CDC.
The Saving Lives and Livelihoods initiative, set up to urgently procure COVID-19 vaccines and ensure their prompt distribution to millions across Africa.
The Save Life and Livelihood supported African people to avoid the consequence of COVID. And we know that Africa was well protected. We thank colleagues from Mastercard Foundation for their support, but also to build the resilient system we are talking about.
The initiative was also dedicated to empowering healthcare institutions, rapidly expanding vaccine administration with the ambitious target of achieving 70% coverage and establishing local vaccine manufacturing capabilities within the continent. This bold $1.5 billion partnership was focused on saving lives and safeguarding livelihoods in Africa. Recognizing that a well-trained, motivated health workforce is the cornerstone of an effective healthcare system, the program launched comprehensive training programs. From aspiring nurses and doctors to laboratory technicians and community health workers, these future healthcare heroes were equipped with the knowledge and skills they needed to make a difference. By mid-2023, over 37,000 health workers were trained and deployed, significantly boosting the capacity to deliver healthcare at a local level. As the initiative unfolded, the impact was visible in hospitals, clinics, and remote rural communities.
Our countries initially didn't have this Africa CDC bringing them together, but we are getting there because we have strong support from our head of state, from our member state ministers and others.
The program's impact spread across at least 25 countries, and Africa CDC's capacity was fortified, including the integration of over 106 new staff, bolstering the continent's ability to respond effectively to other health crises.
There can be no global health security without regional health security. Public health is fundamentally tied to resilient economies.
The Africa CDC, through the Saving Lives and Livelihoods initiative, empowered the health workforce, leading to a significant enhancement of primary healthcare systems. This bolstering of the primary workforce has been instrumental in early detection and treatment of preventable diseases such as acute diarrhea observed in Harar, Ethiopia, and other regions.